This is TriCountyMedia. I'm your host for today, Maria Landry. We're here at the Palmetto Clinic, and I'm here to inform you about what treatments the Palmetto Clinic has to offer you. So let's get started. I'd like to introduce to you Dr. Worley, Ms. Jennifer Ebert, okay, and Ms. Judy Burlington, okay. Now, Dr. Worley, my first question to you is, how long has business been here?
Maria, good question. Palmetto Medcare started about a year ago, and we saw a need to provide services for the community that we felt that weren't being met in sort of a regenerative medical format. And Jennifer and I collaborated on the business, and we had the space. We created the space between the two other clinics, and hence Palmetto Medcare or Palmetto Clinics was born.
Okay. Now I'm going to get back to you. Judy and Jennifer, the reason I became interested in this because I was wanting to lose weight in my mixed session. When you go on a diet, you lose it all over. I didn't want that. So I seen the ad on Facebook, and I made an appointment, and I talked to Judy. And this would happen, and I was so interested in what they had to offer. Please, Judy, explain.
So what we have here at Palmetto Medcare is called a body cavitation machine. The machine was purchased around December of last year. We've had several people come through. I did the treatment on myself first before we actually started doing it on other patients. Over a course of about 4 to 6 weeks, I did it very consistently and lost about 3 inches in my waist. The machine is designed to help you not only tighten up and you may lose some weight, but it's designed to help you maintain your weight. You still have to have a good diet plan. You still have to have a good exercise plan. You still have to drink a lot of water because that's how the fat cells are flushed out of your body. And once you get at your goal weight, like Ms. Landrum is, you can come in with this machine and help tighten and tone up your body. I recommend that you do consistent sessions. I recommend about 10 sessions over about 4 to 6 weeks. It's not a one-time deal. You have to have a commitment to it, just like a diet and an exercise plan. But if you stick with it and you do it right and follow the advice that I teach you with throughout the sessions, it's a very successful machine. I finished up a client. She actually finished up Monday. She lost a total of 3 inches in 10 sessions, and she was here for about 5 weeks. So it does work.
Okay, and it's not just for women. Men can do this too, correct?
Men can do it, and you can do it on multiple body parts. Most people focus on the abdomen, but you can do it all over.
Okay. Now, I had a friend to inquire about it because I've been bragging about it, and of course I'm going to get it did. We're going to talk about the payment plan later. But anyway, she's a truck driver, and you have so many people that swing 12-hour shifts. So if you have to skip a week and keep to the plan that you're offering, I know it won't work as fast, but it should still work, correct?
It should still work. It's designed to not make your fat cells be eliminated completely. They're not going to disappear. But what it's going to do is it takes what you have in your body as a fat cell and it pulls out what's inside that cell. So that's how you actually lose the inches. Some people lose pounds along with inches, but more likely you're just going to lose inches. But keeping your diet and your exercise plan going, it's still going to work. I just have to tell people, remind them that it's not a one-time thing, and that you can't leave here and go eat a pizza, and drink a whole Coke and think that you're going to walk in here and, still lose your weight. Yeah. But
no, I can't eat this. Okay.
Committing to it will show you positive results.
Okay, that's good. That's good.
One thing that Julie probably didn't tell you is she's also a personal trainer.
Okay.
So people that would miss a week, she's more than willing to give them a regimen to do on their off week.
Okay.
To try to not lose ground.
Okay, and that's what a lot of people would need, especially because, like I said, you have truck drivers, people that swing 12-hour shifts or work days and have to come either in the evening or in the mornings, and it's so hard when you have to go home and get some sleep to do a lot of things. So that would help tremendously. Okay. Now, Dr. Worley, you also have the clinic next door, the Palmetto Stem Cell Clinic, correct?
Correct.
Okay. Well, in our next segment, we'll talk about that, but right now we want to talk about the Palmetto Clinic. So, what treatments do you offer, and for what ailments would they work on?
Well, at Palmetto Medcare, Palmetto Clinics, we like to think that we work on joints, skin, and life. Okay, and all of those incorporate different treatments that we have, including hormone replacement therapy. One of our favorite and successful treatments for a lot of different reasons is vitamin intravenous drip, right? And the real exciting news for that, even though for just staying well and rejuvenating the immune system, but what we found, and Jennifer can explain the details, and people with addictions, opioid addiction is huge, right? And a lot of people are on methadone to get off of opioids, which really is an addiction itself. So there's a NAD, or NAD for short, IV treatment, with also some exciting news called the Bridge that we use, and has had super success in a short period of time of helping these people not only help them get off the addiction that they're on, but truthfully help them feel better than they have in 2 or 3 years, because it's a completely different brain response, right, with the Bridge machine as with NAD treatment. And I know Jennifer's super
please
excited.
explain that to me some.
Lots of times when people have problems with addiction, they're depleted of nourishment. So the NAD offers replenishment of nutrients that they may be missing. And that's also good for people with forgetfulness or early onset dementia. But the Bridge looks like a hearing aid, and you wear it around one ear for 5 days, and it sends a signal to the amygdala in the brain, lots of alphabets, no test, but it confuses the part of the brain. Lots of people want to quit, but they're afraid of withdrawal, which can be horrible. So this gets you through the withdrawal, and it's a bridge to what comes next.
Okay.
Whether it's inpatient treatment, outpatient treatment, or continuing on with us with some other options, naltrexone or something like that. But we really realize that this is crippling families and ruining homes.
Yes.
And offering people another option, like another opioid, may be what works for them. But when the time comes to let that go, or maybe they don't choose that option, there is something else out there. There is help.
Good. That's
And,
good.
And that sums up really a lot of most everything that we do, in that we have an alternative to what most people think can be treated medically or surgically or on their own, and they actually may need help, right, or coaching, whether it be for diet or exercise or the ultrasound cavitation. But all the services, 95% of them, because Jennifer still practices family medicine.
traditional medical visits, if you have a sinus infection or you need a physical or a sports exam, then that's available too.
Well, this takes away from the traditional medicine that they have today, because from my understanding, what y'all offer, say that you're losing cartilage in your knee and the doctor wants to recommend knee replacement, you have another alternatives, don't you?
Right. We have alternatives on both sides. Okay. So I'm primarily geared with the stem cell clinic, which we started 3.5 years ago, right? So that's been going on a good while. And so we use stem cells and materials to regenerate new cartilage. Some people that might be a good option for, either for financial resources or things of that nature. We have been using another anti-inflammatory regenerative medicine product, on the Palmetto Care side, that helps people eliminate their joint pain and it's much better, right, than having cortisone injections,
True.
right, as with other, oral medications. And I don't know, Jennifer, how many have we done, or do you guys maybe?
A lot. we
I mean,
have
hundreds,
over,
probably.
yeah.
Well, let me ask you, since you said a lot, how long does how long it takes before you feel a difference, from the...
Well, everybody's different. And, we have 4 people right here. We could each have one of those injections. We'd have 4 different responses. I have had some people that feel almost like they jump up and put their walker aside and I'm feeling better.
Wow.
Okay. There are some people that it takes 3 to 4 weeks. But the option is it's not taking a medicine that's going to make you feel drowsy or sluggish.
Okay.
It's not a fast alternative, but with patience, then you can get some response.
Call from Charles.
And you can repeat that over a period of, if you had one in your knee today, in 90 days you could repeat. Each time you get a little bit more healing.
Mm-hmm.
Whereas what's offered on the stem cell side is usually a one-time intervention. But over here, lots of times people that have straight Medicare and to supplement pay nothing out of pocket.
Okay. And that's another question. I know when I talked to you last, you said insurance at this point still covers some of it, but the laws are changing every day. So what treatments do you offer that the insurance will cover some or most?
Well, the amniotic fluid or the amniotic injections, and mothers are screened. It's live, healthy births. It's not anything like you hear about on some of the darker side of the internet, but it's donated tissue from a live, healthy birth. Mothers are screened extensively. The labs are FDA approved. And so the product itself is FDA approved. I forgot your question.
So insurance.
Insurance.
Insurance. So usually Medicare.
Okay.
We are trialing a product that we're hoping insurance will cover. We're waiting. We've tried a couple of different people. We're waiting to see what response it is.
And that's for the stem cells. So the exciting news is, things are changing, FDA regulations, right? But so there is one particular lab, of the many labs that offer donor tissue. Okay, it could be the lung or heart or liver replacement. An umbilical cord falls in that same kind of tissue bank, right?
Okay.
So all what Jennifer was saying is all those tissues are under the guidance of FDA, and the labs are super scrutinized of how they process all donor tissue.
Okay.
So when we're talking about the umbilical cord and the birth process, we know that the umbilical cord, as she mentioned, comes from full-term healthy birth C-section babies, right? Mother and parents are the screen, the blood screen before and after, and the lab processes it initially, gets the results through all the testing that they have to clear, and then it's third-party testing from another lab, and those 2 labs have to agree that that's good tissue.
Okay.
Okay, so from the umbilical cord and the birth process, there are 2 main types of stem cells, right? Cord blood stem cells, which comes from the arterial side, okay, and then the Wharton's jelly comes from the tube shape of the cord. So they both have a lot of stem cells. And then we also have the amniotic process, right, in the birth. So currently the amniotic fluid, which is a great anti-inflammatory that she had mentioned, is covered by Medicare. And then going on as we speak, right, in the very beginning stages, in order for a stem cell product, right, which we use next door, it's going through an initial phase of Medicare going through the initial process of any something that's going to be paid by insurance, right? Has an initial phase. So we're able to do the injections with a specific code that Medicare should approve, right? but we just don't know. I mean, they're supposed to, and so us and other clinics across the country, the more data that they can get in this beginning stage, then they'll come back and say, yes, we're going to approve it for this amount, and so forth. So it's
Okay.
just in the baby steps.
So it's pretty much, it's both clinics. If you can't do it over there, you do it over here,
Right.
correct? So we've
Correct.
been talking about both clinics at the same time. Yes.
Right.
Okay,
The main
so,
thing is helping people get out of pain, right?
Yes,
And the
yes.
amniotic offers much better outcomes than the traditional cortisone, right? Which actually destroys the joint the more you have it, whereas amniotic fluid removes inflammation, gets them out of the pain, and allows their own body to start healing itself
Yes.
if it has the
Okay.
potential.
and that's one of the reasons why I'm doing this segment, is because you offer another alternative before you go to get your knee replaced or hip replaced, messed up ACL. You can hopefully give them another way that they don't have to go through all that other pain,
Well,
you know?
not everybody can have surgery.
Right.
Unfortunately, there are people that have problems like diabetes or COPD, and their surgeon may have said, you just have to deal with your pain.
Yes.
And we don't like for people to hurt.
Yeah.
So,
As far as insurance goes with the amniotic fluid, we found that people that have traditional red, white, and blue Medicare and a Medicare supplement plan, it'll cover that injection almost at 100%.
Okay. Will it cover my fat thing?
It will not. I'm sorry, it will not cover that. But
Darn it.
but those older people who are fortunate enough to have Medicare and pay for a good supplement plan, they can come in here and get these injections, and they don't have to pay anything for that. So
Yeah, because when you get up in age, you start to lose college, and another reason why I'm here, because a lot of it, things that you offer, I am interested in, and we'll talk further on that. And now with your treatments, what side effects do you have?
Well, which from the stem cell side, virtually the only negative side effect is the potential of getting a little rash or irritation or infection around an injection site, just like with any other injection, right? There's an 87% chance, right, that it's going to regrow cartilage like it's supposed to. So that's about a 12% chance that it's not going to help.
Okay.
For those people, and there are multiple labs, right, different products and how they're all processed differently. We think, and I believe personally, that we use the best stem cell products on the market, based on density, based on 3 years of doing over 400 injections and knowing what works. So there's still always that chance that it's not, even if we did 4 joints in one person and 3 joints work, there's a 10% chance that that third or fourth joint's not going to take. But our guarantee is if it doesn't work, because it takes 8 to 10 months, right, for the stem cells to completely grow new tissue. But from a pain standpoint, when we're talking stem cells, the pain's generally gone in like a day or two, or maybe a week or two. But it takes 8 to 10 months to completely go through its process of replicating new cells and tissue, whether it's a joint or muscle tissue or wherever we put that. So the beauty of, if it doesn't, then we'll offer another injection at no cost 8 to 10 months down the road, because we know that's how long it takes to really visually see if something's going to help.
I'm going to segue into something a little bit different. Sometimes people have religious or other objections to receiving tissues that are donated from other people.
Right.
You might think of Jehovah's Witnesses as one group. And so there is an option for them. And we can draw their own blood, spin it down, and use that product for their joints.
That's great. Yeah.
Unfortunately, that's not covered by insurance, but we do offer different pricing for that. So there are things we can do. We've tried to offer everything, and that's called Platelet-Rich Plasma.
Okay.
And that's also what we use for our facials. And we can use Regenerative product if someone wants. Right now we're offering introductory specials on those, so if anybody wanted to check with us on that.
And that is, now repeat that, regenerative.
product, which is
I'm interested.
the amniotic fluid or the stem cell products. They make some of those for cosmetic use.
Okay.
So whenever you see someone as young and vibrant as Julie, and then they're years down the road and haven't taken care of themselves like me, but you've been in all these Zoom meetings with the quarantine and you're going, oh, that's what I look like. Or you want to, you said collagen a few minutes ago, or he said collagen, and you have collagen loss.
Okay.
So this can help you regain some of your collagen and kind of turn back the clock a little bit.
So they help these lines I got up here, huh?
To a point.
To a point.
I had one 2 weeks ago. So.
Did you?
Yeah.
Yeah.
All right.
With my own PRP.
So,
See, that's I like that. I like that.
but
Now, the vitamin 4, what is?
IV, intravenous.
Okay. And what is that for?
So, well, multiples, as you can see, Maria, on the back. And we'll just, no, actually that's,
probably Larry.
so vitamin IV drips, meaning we use different vitamins, whether it's, most of the time it's a collection of different vitamins, and then we infuse those through an intravenous drip directly into the bloodstream. And if we're targeting something, again, NAD is one of those, vitamin C, right? We can get that directly into the bloodstream. So the advantages of using intravenous treatment is people take a lot of pills, right?
Yeah, and I can't take pills, so that's what I'm
Right.
interested in.
It's funny, I had a couple that said they finally calculated all the number of tablets that they take, and it was like over 4,900 pills,
Wow.
vitamins and
Yeah.
nutrition in a year, right? So that's a lot. But some people, and most people, I would venture to say, have some digestive issues, right? That's not fully absorbed into the system. So when we take those same nutrition and vitamins, whether it's, just for healing, if they are recovering from an illness, if they want to sustain an immune system, if they've had a little too much the night before, right? And they're not feeling all well in the head. So there's actually a nutrition intravenous treatment to help, recover.
Okay.
Right? And so it goes directly into the bloodstream, so that we don't have to worry about digestion, like taking them through a pill or a tablet.
Now, when I talked to you before, you were saying, and I'm one of them, where your hair just go in cycles, but the older you get, the slower it grows. Does this help with that too?
Absolutely. There's formula with biotin, I think, that helps not only the skin, but the hair, the face, the skin and the hair creates a glowing aspect, with gluten and biotin, and so we can address all kind of issues with nutrition therapy, and it's just like 100% gun-ho when it's intravenous versus taking it orally.
So how often would you need something like this?
I think most treatments, the NAD, if we're trying to get somebody off of an addiction, that's on a regular once a week, initially 2 to 3 times a week, or
It depends on how depleted they are.
yeah, that's the bottom line. But I think in general, 4 to 6 weeks,
Okay.
depending on
what.
depending on what you want to accomplish, right?
Okay, mine would be hair, skin.
Right, and that's pretty quick once you get glutathione, or biotin in your system. It's almost pretty quick because you lack it, right? Or we lack certain ingredients, and then boom, it's infused in you, and it just shows up very quickly.
Okay, so say I come in and I'm very interested in that for the treatment, because my hair used to be down here, and then I
Right,
got
you
crazy
told me
with
that.
all the styles, and so, but I'm at a certain age that it just don't want to grow. It's mad at me, I guess, I don't know. But that would help with that.
Well, sure, and it goes back to what Jennifer was saying. In your body, our bodies get depleted of certain nutrients, right, that helps hair grow,
Okay.
right, or the follicles
Right.
get clogged.
Alright.
which you had mentioned, like with the glue or the wigs. And
Yeah.
so the direct injections, right, with the PRP actually helps directly go into the hair follicle to get restored.
Okay.
And
I'm
we
glad-
use very powerful numbing cream. It's
Okay.
not like an injection where you're going to feel a lot of pain.
Okay.
Okay.
Now, and I'm glad you brought that up because you have a lot of women that wear the lace wig, so they losing the follicles are clogged up around the edges from the glue.
Mhm.
Your treatment will help with that to unclog and that way their hair start growing back.
Absolutely.
Okay. Very interesting. Thank you. Thank you, all of you so much. And we covered both places at one time.
Well,
Great.
We did miss
What?
one important thing.
What's that?
The he shot and the she shot
Oh.
for male and female sexual wellness.
Oh, okay. Go ahead.
Because there are different things that affect the love life,
Yes.
okay? And that's a very important part of life.
Yes, it is.
And we have various treatments with men when they may have some injury or some problems with meeting their expectations or the expectations of a partner. We can do PRP injections and help them get back to where they would like to be.
And that instead of taking Viagra
Well-
and give yourself a heart attack, this is
Well, no.
another alternative.
Well, lots of people use this along with Viagra.
Mhm.
It just depends on what else is going on in their bodies.
Okay.
But I will say too, just in short, so there's, for men, right, some men have ED,
Mhm.
some of that might be to prostate issues, right, some may be just to other issues. And then the other is enhancement, right, so we treat ED, and if somebody wants enhancement, which increases the sensitivity, and the sexual awareness, then that's the awesome news, for men.
Mhm.
There are also supplements, natural supplements, right? So there is an answer to not having to take Viagra, but if there's nutritional supplements that
Yeah.
will help the men increase their testosterone, which brings up a great point. First of all, when Jennifer does the evaluation, we have to consider, is that person lacking, male or female, some hormonal imbalance,
Yeah.
right? So we investigate that, right, through lab work, and then we can then decide on a treatment plan.
Yeah, because
okay?
a lot of it comes from medication that the doctor has given you too that might,
Well, everybody gets a consultation and
yeah. And that's when you
Okay.
come in to see what's going on.
And for the women, because I want Jennifer to really touch on this, women also have, sexual wellness and function issues. And as you get older, right, a lot of women have incontinence issues, right?
Okay.
Or they laugh, or they have to frequently go to the bathroom.
Yes.
And Jennifer
Right.
has great experience firsthand. So.
Right, and there again, it's an option. There's no downtime. There's no surgery. There's and not everybody's a candidate, but they get an evaluation.
Okay.
So if you think about, you come into your doctor and they say, "Oh, drink more water." Well, that's easily said, doctor, but then I'm going to stay in the bathroom, or if I drink a big glass of water, and I'm not going to go down the road to see my friend. So if I have a choice, I'm going to go see my friend, forego the water, and get more dehydrated.
Right.
Okay, so this gives you an option to help keep everything more healthy and deal with some of those early, now, frank incontinence where people are, there's a point where it won't help, but if we catch it early, you can still drink your water, still have your social life, go see your friends,
Mhm.
take that trip with your loved partner or your sisters and family, and enjoy it without worrying, where's the next gas station?
Okay. Okay, that's
Because
great.
no one likes a gas station bathroom.
No, or surgery. Yeah, or surgery. Okay, well that's great. Now, I don't care who do it. Let's do a recap of both sides offer, okay, so that people could know. Yes. Oh, it's a long list. I
It's
don't
a
care.
long list.
Yeah, but please give a recap so they know.
Okay. Well, I'll start on this side. We offer traditional care, traditional physicals, sick visits. We try to offer pain management that doesn't involve things that are going to leave people all groggy with drool going down their chin or create more problems with addiction.
Okay.
We have wellness, we have personal training, and the ultrasonic cavitation, which helps with slimming and trimming. Addiction management. Oh, a new service that we're going to offer is some mental health treatment for people that's an inhaled treatment. We're in the middle of getting credentialed for that. Maybe you'll come back and learn more about
I'll be
that.
glad to.
So we are trying to, I hate to steal the old car commercial where you're not your father's doctor's office, or I don't remember what that was, but we want to help people traditionally, if they need it, meet them where they are in their needs and try to give them options.
Yeah. Good. Anything you'd like to add to that?
Right. So, regenerative medicine versus traditional medicine.
Mm-hmm.
Okay. We offer a lot of regenerative alternatives to just normal health and wellness care.
Okay.
In short, on the stem cell side, I'm super excited. I mean, it's really the passion to be able to help. We didn't go into the in-depths of how stem cells operate,
Mm-hmm.
but if your viewers want to text the number 864-385-1004 and put the message pain-free, one word or two, and then it'll come up with a little icon that says iCard, and they can press that and get our digital business card.
Mm-hmm.
And on that card is a wealth of information, 2 webinars, one's about 30 minutes, the other's about 52 minutes, have testimonies from our patients, video testimonies and written testimonies, and it's just a super opportunity to avoid, right, surgery, whether it's hip, knee, or shoulder, or any joint.
Yes.
So, and then PalmettoClinics.com. So that's the website for the Palmetto Clinics. We have the list of all of our services with explanations. We encourage everyone, regardless of what treatment or service, do your own investigating, and we have opportunities for them to gain a lot of knowledge on all the services that we perform. So.
Okay, that's great. And can you give them the websites again, listening and viewing audience, one more time, and the phone number?
Sure, PalmettoClinics.com. PalmettoClinics.com. Julie, what's the number?
The number to Palmetto Medcare is 864-377-8250, and the number to Palmetto Stem Cell Clinic is 864-953-7836.
All right, thank y'all so much. I enjoyed this.
Thank you.
Thank you, Maria.
Yeah, thank you. Well, this is TriCountyMedia signing off. Thank y'all. Bye.
Bye.
Bye.